What I do is travel throughout the country, teaching individuals like yourselves how to develop an instant recall memory.
Matt Gurr travels the country as a public speaker. In 2015, busy with speaking engagements.
When's your next game, guys? I think it's this weekend, right?
And enjoying life as a grandfather, an innocent sneeze caused him to feel something unusual in the back of his throat.
There was something back there that shouldn't be. I checked the mirror, and something had dropped down on the right side of my throat and was just kind of hanging there.
Upon examination, a biopsy was recommended.
He had a biopsy that showed a squamous cell carcinoma, which is the most common type of cancer that occurs in that area.
The first thought was, this really can't be happening. The next thought was, I got this thing is in my throat. Is it going to affect my voice? Because it's how I make my living.
Dr. Eric Cohen, director of Head and Neck Surgical Oncology at Morristown Medical Center, determined that Matt would be a candidate for robotic surgery to remove the tumor on his tonsil.
It was an opportunity to do a minimally invasive surgical approach as the only treatment.
The more likely you are to.
So for Matt, that was ideal because he uses his voice professionally.
Matt listened to his body, and his vigilance proved crucial to his outcome.
If I hadn't sneezed, I would never have known it was back there. And with its removal, the problem had pretty much gone away. The prognosis was there's no reason to start to radiate or anything like that.
Detecting head and neck cancer at an early stage is vitally important for successful outcomes. People are evaluated for these sorts of things, probably two places. One place would be at the dentist's office. The other place is at people's primary care doctor. People have a diagnosis of cancer in the throat and wonder, what did I do to get this? I don't smoke, I don't drink, I live a healthy lifestyle. Just because they don't have any risk factors doesn't mean it's not possible. It's very easy to ignore some of the more subtle symptoms. It's easy to ignore a painless lump for a while, but having a regular doctor's visits is important for detecting these things.
At Morristown Medical Center, the Leonard B. Kahn Head and Neck Cancer Institute created a multidisciplinary team offering head and neck cancer patients comprehensive care and treatment. A range of disciplines work together, functioning as a cohesive unit to produce the best outcomes for patients.
We have conferences on a regular basis that we refer to as the Head and Neck Tumor Board. We all get together to discuss cases to help decide what to do for particular patients. There's a lot of value in having the opinions of doctors of different specialties who are involved in the care of these patients.
This dynamic, multidisciplinary team is giving patients like Matt the gift of life.
The people at Morristown were phenomenal. I felt like I got individualized care. They were working for me. They were very caring. I felt blessed.